Let's talk to our favourite GP, Dr. Dean Eggett, GP in Doncaster, CEO of Doncaster Local Medical Committee. Dean, a very good morning to you. Welcome.
Good morning, Mike.
Good to see you working on a Friday. It was a short week for you, though. You probably weren't working on Monday, right?
Sadly, I'm overworked this week, so I'm looking a bit tired and haggard today. I do apologise.
Oh, crikey. Well, listen, you better take it easy over the weekend. How are you finding this new Labour administration? Because we saw, I think it might have been earlier this week, actually, that Wes Streeting was talking about expanding GP surgeries, like physically expanding them so they were bigger. Would that be of any use to you?
Sadly, no, not really. I mean, he's saying all the right things. He understands that we need more rooms. He understands that we need more doctors, more bums on seats.
Yeah.
And that's the sound bites that are coming out. But when you look at it in more detail, it doesn't seem to be anything that's actually going to make any material difference.
Yeah.
So if you look at the money that's just been invested in GP premises, that's 100 million that's spread across 1,000 practices.
Yeah.
So each practice might get £100,000. Now in central London, what on earth are you going to do with a building with £100,000? You might be lucky to buy a disabled toilet or to refurb and put some paint on.
Yeah.
So that's not actually going to do anything to provide capacity in general practice. But he said the right things. He obviously understands. He's just unable to do anything that makes any material difference.
Right. And what about this business of, I mean, obviously digitalising the health service is probably a good idea in principle. But again, it seems to be like there's lots of parts of it that aren't joined up, and joining them up presumably is going to take a long time. And it's also going to cost, they reckon, around £21 billion over the next 5 years. How are you finding that digitalisation going?
So in general practice, it's not too much of a problem. We've been digital for many, many years now. The main issue actually is digitisation of hospitals and the social care sector, because they're not digitised at all. So imagine running around a hospital still with a piece of paper. You don't have all the benefits of digitised access to the records, or computers helping you make decisions, or even automatically calculating things for you, like the risks of patients that make you think about how to care for a patient that you hadn't previously considered. Now, my big worry about this really is the cost and the past history of governments. Now, there was a project like this back in around 2002 that ran almost a decade, and when it almost doubled its budget. So the government binning it. It went from 6 billion to 12 billion.
Yeah, and it never worked, did it?
No, it didn't. It was binned. So we spent 12 billion on pretty much nothing. So if we're potentially now going to put 21 billion into a 5-year project, let's hope it doesn't spiral up to 40 odd billion and come out with nothing.
Yeah. Well, that's always the problem, isn't it, with these big public sector projects? They don't seem to have any proper kind of policing. There doesn't seem to be anybody in charge. I mean, I can think of about 3 or 4 of the similar kind of overspends that have happened over time. I mean, like the Scottish Parliament building, when they started, it was going to cost something like 40 million, and it ended up costing 400 million. It was like sort of 10 times the amount of money that they were planning to spend. And when the architects designed these very unusually shaped windows, and when the window panes arrived to put in the unusually shaped windows, they didn't fit. So they had to take them all back and remake them. You know, it's the kind of thing that only seems to happen really in the public sector. I don't understand.
Yeah, it is. The NHS is seen as a big cash cow, I'm sure. So there'll be many people rubbing their hands together at the thought of this. Any project in the NHS, as soon as you have the title NHS, pop a couple of zeros on the cost of it, and you're probably getting close to what it's going to cost. So the project is necessary, it's needed, I'm all for it, but it's going to be very expensive. And you're looking about 2% of the NHS budget every year just to get it up and running, and then another 1% to keep it running every single year.
Right. And just one off to the side, I don't know if you don't know the answers to this, but the trade deal that's just been done between the United States and Britain has basically still got to sort out the pharmaceutical side of it, apparently, because apparently we sell quite a lot of pharmaceuticals into the US. But they've said, look, you must make sure that a lot of the stuff that you give us doesn't come from China, doesn't originate in China. Would you say to me, if you could, that there's a lot of pharmaceuticals being used in this country that are manufactured in China?
So I can't speak directly to pharmaceuticals, but just generally the supply chain. A lot of what we get, in my understanding, is from China, not from the US, and therefore, just generally, the supply chain to the NHS is going to be very dependent upon China. And there's another bigger problem here, and it actually harks back to the banking problem. I think it was around. Was that around 2012, 2011 as well?
Yeah, 2009-ish. Yeah, 2009, 2010.
big things that happen in the US have this ripple effect of unintended consequences.
Yeah.
So, if you look at one of the reasons why the NHS is in such a state at the moment, it's because of the world financing problem that
Yeah.
happened back then, and that was US centric. So, Liberation Day might be wonderful for the US, but it is going to have repercussions for the NHS, whether we like it or not, simply because of financial markets.
Yeah.
We're yet to see what that actually means.
Yes, no, I think we'll keep an eye on that. Dr. Dean, very good to see you. Have a good weekend. Dr. Dean Eggett there from Doncaster, from the GP surgery, basically saying that West Streeting's latest ruse, which is to expand the size of GP surgeries to make sure that more people can be seen, will be of absolutely no use to him at all. And not much use to an awful lot of other doctors' surgeries either. Hardly surprising, is it? We could have told you that. In fact, we did tell you that.